Welcome back, Sparsha, for session 6. Tell us what's in store for the students.
Session 6, this is certainly within your expertise, Nivi. So I'm so glad that you'll be with us for this. But we know that there are preventable deaths that are related to heart disease, to diabetes, to cancer. And unfortunately, I don't think we're talking enough about what we're putting in our bodies that is leading to 11 million premature deaths every year that could be avoided through diet. And this comes from the work of Dr. Walter Willett, the work of Marco Springman. So there's so much good science around this. We know that there's a connection to preventable lifestyle diseases and what we eat. And yet we are kind of failing to make those changes that will lead to a healthier population that will be more equipped to handle the changes that are to come to our planet as climate change keeps getting worse.
Yeah, and thank you so much for talking about this. I think the last session spoke about infectious diseases. The next one is going to talk about non-communicable diseases.
Yeah.
Not too long ago, I remember, at least when I was in school, we were taught about diabetes and think about diabetes as a disease of affluence and as an adult onset illness. And both of those things are not true anymore. And it totally depends on geography as well. I grew up in India, and I remember that adult onset illness, diabetes type 2, you would expect wealthier people who would have greater access to animal based foods and richer ghee and saturated fat and so on to get this illness. And at the same time, I identified India as a predominantly vegetarian country. And then, the latest census actually shows that more than 70% of South Asians identify as non-vegetarian, people who also include some animal products, in their diet. It's really important that what we're going to be talking in session 6 is how we want to move back towards a plant-rich, micronutrient-rich, fiber-rich dietary pattern, and the co-benefits.
Exactly. And I think this one thing we'll talk a lot about is how this is the result of big agriculture, right? Big Western agriculture sort of coming into other countries and changing how the food is being created. You will be talking much more about that. And in the United States, subsidies that enable unhealthy foods to be more accessible and to be cheaper end up hurting minoritized communities the most, right? In many cases, these are communities that can't handle lactose. They can't handle some of those other elements that come with Western-centric diets that are cheaper.
Yeah, absolutely. And combined with session 5, session 6 will give a complete overview to the students of the 2 top profiles of illnesses that are actually on the rise, both because of the infectious diseases and superbugs and antibiotic resistance that you spoke about in the previous session, and then the non-communicable diseases.
Exactly.
Yes. So again, yet another milestone lecture with rich content, all scientific and evidence-based. Thank you so much, Sparsha, for the
Thank you. See you soon.
in the next one.